My name is Dr. Roger Goldstein. I'm the head of the respiratory services at West Park Healthcare Centre, and I've been involved in the rehabilitation program for a number of years. The patients enrolled in pulmonary rehabilitation tend to be in their 50s, 60s, and right up to their 80s. They're people with chronic lung disease. The commonest is COPD, which comes from smoking, but we also see many individuals with restricted pulmonary disease and other less common conditions.
A lot of them have been living on their own but have been having difficulty managing at home. They've had an exacerbation or they're just not doing as well as they would like to. So a lot of them come in through recommendation of their family doctor to come into our program.
Having a resource like West Park Healthcare Centre is very important because people that aren't receiving any help I think would be living a very desperate life. It's very hard to deal with something like shortage of breath.
So there are two main components of pulmonary rehab, the first being the education component. So patients attend classes that teach them about their lung condition and how to manage it. So different coping strategies, learning about different activities of daily living and how they can do them while managing their shortness of breath.
The biggest impact that I've had through this program is learning about the disease, the effects of the medications, and when I need to go on, let's say, antibiotics and steroids. Just the general knowledge of the disease and what's happening, it's comforting.
And then the other main component would be the exercise component. So giving them an exercise program once they've been fully assessed to increase their functional capacity and then allow them to participate in those activities of daily living.
We have groups that are focused on things like showering, dressing, meal prep, and talking about what difficulties are they experiencing during these activities and what kind of modifications that can be used to get them back to, instead of avoiding that activity, enjoying that activity again.
In addition to the chronic lung disease, many patients have comorbidities, and so the program is modified to identify and tackle the comorbidities that are present.
We work really closely as a team. If I'm identifying an issue with eating, it could be something that has to do with SLP for the speech-language pathologist, so we often refer to them. For physios, we might prescribe a walking aid. We also work together with the social worker, dietitian, and even with CCAC, so community resources as well.
We have respiratory therapists, occupational therapists, nurses here in the day hospital. Outside of the day hospital, I see a respirologist on staff, a psychologist, a dietitian, and a social worker.
Applied research is integrated very readily with pulmonary rehabilitation. The healthcare professional community is small, so either electronically or through international meetings, if there is a development in Europe or Australia, we hear about it quickly and we have the opportunity to integrate it into our program. We recently learned that patients with lung disease can exercise with one leg more effectively than with two. That's an example of applied research, published and integrated into the program.
There's a lot of behavior change that we have to work on, and that's really the main component, is just trying to get them to see things in a new way and to adopt lifestyle changes.
When they go home on the weekends and say that, we used your strategies, we used your pacing, we used the equipment that you recommended, showering is so much easier, or I was able to make dinner for my family this weekend. That's one of the most rewarding measures.
Pulmonary rehabilitation is now recommended by professional societies around the world. There's very good evidence that it improves activities, exercise capacity, quality of life, and reduces the anxiety and depression associated with chronic respiratory disease.
The people that I meet here at West Park that are going through the same difficulties as I am are an inspiration too. The people band together. We have social events, barbecues, and it's really nice to be with these people socially. So it's not just a clinical setting, it's friends getting together.
It's a very common thing for patients to say at the end that they've got a new lease on life. Their family and their friends will notice that as well. They can see those changes in them throughout the program and definitely once they go home.